Hello, this is Dr. Ron Valdesari, and I'm reporting from the 20th CROI meeting here in Atlanta, Georgia. And I am very pleased to be joined by my colleague, Dr. John Ward, who is the head of viral hepatitis activities at the Centers for Disease Control and Prevention. And as some of you know, the CROI meeting, although the major focus is on HIV, really has strived to put more and more focus on viral hepatitis. And John, you gave a very excellent plenary yesterday on viral hepatitis. Could you share with the audience some of the high points from that talk?
Well, HCV and HIV, have a lot in common. They share modes of transmission. 4 to 5 million persons around the world are co-infected. If you're infected with HIV, your liver disease from your hepatitis C viral infection progresses more quickly. And so, as a consequence, one of the leading causes of death now among people with HIV is liver disease, and much of that is hepatitis C. The good news on the horizon for hepatitis C is that the treatments are rapidly improving. There are about 40 drugs in various stages of clinical trials that hold great promise that within the next several years we'll be having all oral regimens that really constitute a once-a-day dose for about 12 to 24-week duration of treatment, resulting in a 90% cure. And for people like Ron and I who've been working on HIV for a long time, that's really an astounding news that you can actually cure a chronic viral infection with that degree of certainty. And so it's really changing the whole concept of hepatitis C from a chronic, difficult to treat disease to one that's going to be fairly readily treated and really brings up exciting new opportunities.
So I might take that one step further, John, and say that not too long ago, maybe 5 years ago, a lot of healthcare providers thought that there wasn't really much that could be done for hepatitis C. And as you said, we're now entering an era where the treatments are improving at a fast and furious rate. But that brings me to the question I want to ask you. We know in the United States that roughly about 20% of the million people who are infected with HIV are unaware of their infection with HIV. They have not been diagnosed. Could you tell us what the comparable figure is for hepatitis C in the United States?
Yeah. Regrettably, it's much worse. We estimate that about 45% to 85% of persons may be unaware of their hepatitis C infection. And it's a much larger problem. Certainly millions of the 3.2 million we believe are living with hepatitis C. At least half are unaware of their infection.
And I think to share with the audience, that's why the CDC this past summer released new guidelines for screening for hepatitis C. And John, very briefly, would you like to share with the audience what those guidelines say?
CDC now recommends a one-time hepatitis C test for all persons born during 1945 through 1965. That's because for that population of Americans, they have a 5-fold higher prevalence of hepatitis C than other adults. About 1 out of every 30 have evidence of having been infected with hepatitis C virus. And of the total population with hepatitis C, 3 out of every 4 are in that age group. 80% of people dying from hepatitis C were born in those years. So we really want to target them with a simple blood test. You know your status, and you can take action if you're positive.
I just want to remind our viewers also that the Department of Health and Human Services, with a great deal of input from my colleague here, Dr. Ward, 2 years ago released a viral hepatitis action plan for the United States. You can read that plan on AIDS.gov, but one of the major features of that plan is really making a better effort to get people who have chronic viral hepatitis, and we're talking both about hepatitis B and hepatitis C, to get those folks diagnosed and into care, because knowing about their infection and receiving appropriate care, including antiviral treatment, can really be life-saving. So in closing, I want to thank you, John, for your comments.
Thanks,
and
Ron.
This is Ron Valdesari reporting from CROI 20. 2020 in Atlanta, Georgia.